Well, May, we should tell you, and we've talked about this throughout the month of May, but May is National Stroke Awareness Month, which is really a time to increase public understanding of stroke prevention because it could save a life, a very precious life to us. So joining us this morning is Dr. Brendan Ebi with WashU. Thank you so much for waking up with us this morning and being with us on Memorial Day.
I'm excited to be here and talk about my passion, stroke.
Yeah, and I hope that also because it is a holiday, people are waking up and saying, okay, I'm going to be empowered with great information today.
That's my hope too. This is all about outreach, making sure people know about stroke, and so the more people tuning in that we can partner with, I'm really excited about.
Me too. And so tell everyone what you do for a living.
Yeah, well, I'm a neurologist and specialize in stroke. I'm an interventional and vascular neurologist. So I diagnose stroke, I treat it both with medicines and with surgery, catheter procedures. And then I see those patients, as they recover from the stroke, getting into the hospital.
Okay, and recovery can be so challenging too. We've been talking about that throughout the month of May.
Absolutely.
Okay, so what are some of the most obvious signs of stroke? I think a lot of people think they know, but it's always a good reminder. What are some of the signs that we should all know immediately?
Yeah, when we talk about stroke, we're talking about part of the brain not getting blood flow, usually to a blockage, a blood clot, and so that part of the brain stops working immediately, and it results in symptoms can be all over the body, as you can imagine, from the brain, but there are some that are more common. Some of your viewers might know about the acronym FAST. We use this to remember what to learn for. We've actually updated it in the last couple of years for Be Fast.
Oh, okay.
And each of those letters represents something to look out for stroke. So B is balance and E is eyes. F is face, A is arm, S is speech. And then T is time, and that's just a reminder that stroke is a medical emergency, and so you should call 911, you should go to the hospital as quick as possible. With each of those symptoms, there's a risk that that represents a stroke. So sudden onset problem with any of those could be a stroke, and the more of those you have, the more concerning it is for a stroke.
Okay, so you could really just have one of those symptoms then with your balance or maybe the slurred speech or something, and you could say, wait a minute, let's evaluate what's happening with you. Is that what you would do?
If you have sudden onset of any of those, I would say take it seriously, and we'd ask you to come to the hospital. So yeah, balance is really tricky. It can be trouble walking. It can also be dizziness, like room spinning vertigo. If you've never had that before, it comes on suddenly, that's a time to call the ambulance, even if you don't see any of these other symptoms.
Oh wow, good information. Now, are there any other lesser known symptoms as well that we should be looking for?
There can be a lot of issues, that come with stroke. Some people talk about confusion. Some people talk about generalized weakness. We really worry about when you have weakness on one side of the body, the same side, so the same face and the arm. But if you have it all over, that is a concern. One thing I actually do want to point out is that headache is not on that list.
Okay.
So you don't have to have a headache for it to be a stroke. A lot of people think, oh, well, I'm having these trouble, but I'm not having a headache, so it can't be a stroke. I shouldn't call 911. I should wait at home and see what happens. And that's absolutely not what we want people to do.
Okay.
If you have any of these symptoms, you should come to the hospital and get checked out.
I think people are always scared, right, to call the hospital because, oh, it's probably nothing. It's going to pass. It could be just a fluke or something, right? But you think people should at least call?
Yeah, I love seeing people who don't have a stroke, right? That makes my job a lot easier. And I'd much rather it be a bigger deal. You come in when you get checked out. Nobody here at the hospital is going to be upset about that. That's what my job is. But if you had a stroke and you waited at home, we might miss an opportunity to be able to treat you and make those symptoms better. And our treatments for stroke are very time dependent. For the clot buster medicine that we give, you have to get to the hospital within 4.5 hours from when the stroke starts. Otherwise, it's too risky to give that medicine. So if we wait, if we dawdle at home, then you lose the opportunity to treat that stroke.
Wow, that's great information. Also, if the symptoms only last a few minutes, or I guess how long should the symptoms last before you say, okay, it's time to call? Can they be signs of stroke if they only last a few minutes?
Yeah, that's actually an excellent question. If the symptoms go away, I'm still very worried about that. Obviously, we might not need to do the surgery or give the clot buster medicine, but I still treat that like stroke. We have a special category of stroke for those. We call them TIAs, where symptoms come on, but then they go away. And I treat that the same as a stroke. Essentially, somebody got lucky and it didn't cause permanent damage. The next time, they might not be as lucky. So if you come out, we can still evaluate all of the risk factors. We can see about certain medicines or blood thinners to try and prevent the next stroke, because you don't know if those symptoms are going to go away. So I wouldn't take any time at home. It's not about waiting 15 minutes or an hour to see if they go away. As soon as you see those symptoms, come to the hospital. If you get better before you get there, there's still a lot of things that we need to do.
Okay, and although it's rare, stroke can really happen to anybody, right?
Anybody, any age, So adults can have strokes, kids can have strokes too. I was just talking to one of my colleagues over at St. Louis Children's, one of the stroke experts there, and she pointed out that pediatric strokes are about as common as pediatric brain tumors. Wow. So, we hear about that in the news all the time, and parents get really concerned. But if an ambulance driver brings in a patient, a kid, and is thinking, oh, I'm really worried about brain tumor, we should be thinking about stroke too. Now, it is rare in kids, but it happens, and we have treatments for it similar to adults. So we want to make sure that everybody knows that there is some chance for it, no matter who you are.
Right. Okay. And so if there's one takeaway, if you're watching and you're tuning in, what should that be? Should it be that, be fast, or what do you think the takeaway is?
Well, it's be fast, and then when you think that you're having a stroke, dial 911 and use the ambulance to come into the hospital. A lot of people are also wondering, should I just drive myself to the hospital? And I would say, please don't call 911. The paramedics can assess you, wherever you are, and make sure that you're stable, there's not something else going on. But we have a special partnership with them. They call the hospital ahead of time. They activate what we call a code stroke, and you get fast-tracked through the ER. We're able to take care of you even quicker, get you straight to the CT scanner, know if you need those treatments. And so we've been doing a lot of work partnering with the ambulances around the area, and they're going to be taking care of you straight from when they meet you in your house to when they come through the doors, an early, quick pathway to make sure that we're ruling out stroke.
Oh, that's so wonderful. Yeah. Thank you so much for all that you do. Yeah. Hopefully you will have a quiet day today.
Thank you.
And also thank you for coming in. This was so
enlightening.
So
excited. Thank you so much.
Thank you. Dr. Ebi, thank you. All right.